The proposed Faculty of Engineering in the Nasarawa State University (KEFI) has received another set of educational training equipment from the National Agency for Science and Engineering Infrastructure (NASENI). The ceremony took place at the auditorium of the School of Postgraduate Studies of the university. The donation of the equipment was an expression of the agency's fulfillment of the terms of the Memorandum of Understanding it signed with the university in July 2019.
While delivering my speech last year during the handing over of the donated training kits, I made promise that more of such donation will still come. What we are doing here today is in fulfillment of that promise. The electrical power training equipment the agency is donating to Nasarawa State University today is in line with the MOU and our commitment towards the establishment and development of new faculty of engineering of this great institution.
The Vice Chancellor of the university believes the donated equipment would aid the accreditation of the Faculty of Engineering in the university.
We are gathered again for the second round of this donation by the Executive Vice Chairman and CEO of NASENI. On behalf of the university, I want to express our profound appreciation to Professor M.S. Haruna for this support. I can say without fear of contradiction that if there is any support that we have gotten in the establishment of engineering, I believe that M.S. Haruna is the person who has given us all that support. And we believe that when the history of the engineering program will be written, your name will be conspicuously written as somebody who has made enormous contribution for the establishment of engineering.
The Nasarawa State government is delighted with the support received by the university and will support the growth of education in the state.
Today, in Nasarawa State, under the administration of His Excellency Engineer Abdullah Isle, education has been given a pivot role in the affairs of things. For those of us that have been following the activities of government, in the 2020 budget, education was given the topmost priority.
The equipment donated by NASENI are complete hydroelectric power plant trainer, wind power plant trainer, smart grid basic configuration trainer, and solar energy trainer. The Melafia football tournament, which lasted for 1 month, has come to an end with Kiana selected, emerging winners after defeating Dedere United in the finals. Throughout the regulation time, none of the two teams was able to find the back of the net. This resulted to penalty kick, which saw Kiana selected winning after its goalkeeper saved 2 penalty kicks to end the game 4-2.
Ita ce za ta fara bugawa Adamu it is a goal Agere a wonderful one here.
Organizers of the competition say the essence was to unite the people through sports, given the crisis that has rocked the Central Zone in the past.
4th edition, as it is tagged, is peace and unity. There was crisis some times ago, that's around 2014 and 15 in this area, and people left their homes, and the whole place was in a sham. I decided to bring in the maiden edition so that we restore peace, and like magic, that is what restored the peace. After the first edition, we found out that there are talents that are hidden in the grassroots. So we now go further to have a project which is called Engaging the Youth.
Actually, we've seen that intention with the present government of Governor Abdullahi Sule. He has been encouraging that. He is making the Ministry of Sports more functional now, supporting the club that is representing the state in all this league competition, that of ladies and secondary schools, primary schools as well. So I think the government has been very, very supportive, making every effort to see that sports activities is being brought back, after realizing that it's one of those things that keep the youth together and disallowing them to maybe engage in this kind of vices that will lead them to banditry and all other vices.
The climax of the competition was the presentation of medals and trophies to the champions and other winners. The security of lives and properties of citizens is a priority of any government. The 4th Special Forces Doma in Nasarawa State was established by the Chief of Army Staff, Lieutenant General Tuku Buratai. It was established not only to be an operational formation, but a roving command to tame the excesses of insurgents, terrorists, bandits, kidnappers, and other criminal elements in northern Nigeria. Since the establishment of the command, major security breakthroughs have been recorded. It has recorded some feats in the last 3 months in combating insecurity in the northern part of the country. One of such is the arrest of the chief priest of Tewasi Akwaza, popularly known as Ghana, and 40 other members of his gang in Benue State. Ghana was killed in September by the Nigerian army after a gun duel for terrorizing Benue, Plateau, Taraba, and Nasarawa State in the last 5 years. Commander of the 4th Special Forces Doma in Nasarawa State, Ali Monde Gazama, says the shrine of the chief priest was also razed down to dust. The recent arrest of members of Ghana's gang brings the total number of the gang members in Nigerian Army's custody to 119.
I would like to state that before now, it was unfathomed for the Ghana's name to be mentioned amongst the thief, Jukun, or Kuteb, for fear that Ghana, under the direction of the chief priest, will see you in the blood-boiling pots of his shrine and his gang's members will go after you. Today, I'm pleased to inform you that not only did the special forces snatch the chief priest, but I'm glad to tell you that the derided shrine has been razed to dust. The chief priest has been responsible for preparing charms for the gang using human parts of kidnapped persons, as you will see shortly. We also have one of the commanders, popularly known as Commandant. Additionally, one of the commanders in charge of armed robbery, called Tukuma, also died under Special Forces siege while in hiding in a village at suburbs of Katsina Ala.
The chief priest confessed to the crime.
I'm
a herbalist from Katsina Ala local government of Benue State. I used to prepare charms for Ghana boys. Recently, 4 of his boys came to me and I prepared it for them. The other day, they came back to me and asked me to prepare a charm that will make them disappear in dangerous situations. I told them that they are too small to carry such charm they are looking for. I refused and they threatened to kill me. I was arrested by the military in an attempt to run for my life from the boys.
The army has also recorded significant successes in the arrest and killing of notorious bandits operating at Utu Forest in Toto local government area of Nasarawa State.
Furthermore, you will recall that during our operation at Otu in Toto local government area of Nasarawa State, we dislodged Boko Haram terrorists and notorious bandits from the area. During one of our covert operations in Kaduna, we arrested one of the dislodged Boko Haram terrorist members named Salisu Usman Dabo, neutralized Boji Bazamfare, commonly known as Bazamfare, while police nabbed Orijeje. You will recall that these 3 names mentioned are among the 4 dreaded members of bandits and terrorists in Otu camp. Presently, we are just hunting for Babuga Yellow, being the 4th person.
The command also recorded another milestone through its Operation Nutcracker 2 in Niger, Zamfara, and Kaduna states. Bandits were cleared from the contagious forests of Chikwale, Sangeko, and Kuyambana forests. As a result of the operation, 200 cows were rescued, 9 bandits were killed, and 8 bandit collaborators were arrested. The command lost 7 of its gallant officers at Kamfani Bibi in one of the meeting engagements, while it destroyed the entire Alhaji Damian's bandit team, which led to the death of Kawawaju, a notorious bandit.
On the Chief of Army Staff's directive upon seeing the plight of the people of Niger State, he directed that the special forces should also intervene in that part of North Central region. And immediately the special forces kick-started Operation Nutcracker 2, commanded by no other person but the commanding officer of 72 Airborne Battalion, where it cleared bandit camps in the Nigerian Army main training area, Namta for short, contiguous forests of Chikwale, Sangeku, Kuyambana forest, where it cleared the notorious bandit headquarters in Dutse Magaji. It also cleared Alhaji Mochiko camp, Alhaji Sharki camp, and Alhaji Maitukur's camp in Sangeku and Kuyambana forests of Zamfara and Kaduna states respectively. The operations conducted in Niger State was in close coordination with Defense Headquarters Special Forces and 31 Artillery Brigade in support of the Nigerian Air Force Fleet.
In a related development, the Nigerian Police has inaugurated 503 Special Constable Police as community police to enhance intelligence gathering with a view of curbing insecurity in the state. The new Special Constables were inaugurated in Lafia at a one-day sensitization campaign on community policing. The Police Community Policing Initiative is aimed at involving the entire structures in the society.
What tonight's Special Constabulary has already been held and positively addressed responsibility. Another 454 Special Constabulary are undergoing training right now. This has not been possible without the support of the state government, and we gradually engage to continue to support them.
The categories of committees that we have in pushing this strategy are Community Policing Advisory Council, which will be at the state level, State Community Policing Committee, Area Command Community Policing Committee, Local Government Community Policing Committee, and Divisional Committees. These committees will be set up, and it has an embracing membership that cut across so many levels or facets of the society.
This state is very big. It's slightly above 27,000 square kilometers, and is surrounded by many states where there are security problems. Plateau in the northeast, Taraba in the east, Benue in the southeast, Kogi in the south, FCT in the west, Kaduna in the north. And not that alone. We have ethnic groups that are, in various parts of this north central, and they have part of them in Nasarawa. We have the chief in Benue, we have the Doma in Benue, and they are in Nasarawa. We have the Basa in Kogi, they are in Nasarawa. We have the Igbira in Kogi, they are in Nasarawa. We have the Bagi in LCT in Niger, they are in Nasarawa. We have the Mada in Nasarawa, we have them in Kaduna. And because of that, security becomes endangered. But because of the assistance we are having from members of the public, we can, interpret the terrain.
Ensuring success of the community policing policy is the priority of the Nasarawa state government in order to combat crime in the state.
To further strengthen the capacities of our security agencies in the state, we have provided logistic support for the training of the 504 constabulary currently in Police Training School, Makudi, Benue State. This is aimed at complementing the effort of the Nigerian police in protection of lives and property in the state. Let me at this juncture commend the efforts of the security agencies in the protection of lives and property, particularly in the enforcement of law and order for harmonious coexistence among the diverse ethnic nationalities in the state. I need for emphasis to acknowledge your dogged commitment and efforts in our fight against the spread of COVID-19 in Nasarawa State. What we have been able to achieve in the control and containment of this pandemic in the state could not have been possible without your absolute support and cooperation. I salute your patriotism in ensuring compliance to government proclamations. I urge you to sustain this tempo for the benefit of all concerned.
The community policing strategy is an initiative of the Inspector General of Police to fight crime in the country. Apart from COVID-19, another deadly disease that has been affecting us, especially in this part of the world, is Lassa Fever. Now the dry season is here. How prepared is the state government in combating this disease?
Thank you. I remain Honorable Amin Obaha, Honorable Commissioner for Health in Nasarawa State. I really appreciate you having you this morning, and I wish to assure you that first and foremost, we have the privilege and lucky to have His Excellency Engineer Abdullahi Sule as our leading governor, who is very proactive and very assertive and understands the review of past performance and activities that go today. As you are aware, Nasarawa State is known with Lassa cases in the previous years that's gone by. And one of the best things we have to do, being a public health cement, is for us to go first on informative assertion to the citizenry of the state. We are, since from the cessation of rain on air, and also to reach the looks and cooling of the tested, to assert them again on the do's and don'ts of Lassa Fever. The way of contacts, that is the mode of the infection of Lassa, and preventive measures. We knew quite a number of our farmers and other activities like displaying their palm products on the floor, and bush burning is one of those things that might also chase the rat out of the bush. And while passing, the image of the rat that puts on our food becomes part of the great factors we have. We also tell the entire citizenry to take into note in such circumstances how best those food spreads we're able to curtail, and cooking of food, covering, and making sure we limit such exposures and contact. And again, on individual to one-on-one contact, for any of those symptoms so exhibited by individual, they should not hesitate to go to hospital. And in the hospitals, also alerted. These are the best period of these cases also come up to be. We are also informing you that since the ABC for preventive measures of COVID-19 is that similar to Lassa, the only thing that Lassa is more fatal, our team of experts are in the note, and we are ready for a refresher course to get them on to be ready in case of any eventuality of Lassa comes on. I believe the two treatment centers we have, both the large adult specialty hospital and that of FMC Kefi, are well informed, and we are indeed ready for such circumstances. Not stopping there, all general hospitals are also alerted on the symptoms and signs of Lassa, so that peradventure, if any of our clients appear in those areas, they will not hesitate to refer to the treatment center as expected of them. The pharmacy and the stores of preventives and treatment of medications and others are also stopped. And we're heartily ready for Lassa. We hope and pray that he never comes. But if he shall ever come, we're ready for the treatment and to combat it accordingly.
All right, the healthcare workers are the front line of this battle. Yes, how protected are these people? Do they have PPEs and other materials that they need to ensure that they combat this disease?
As I told you earlier clearly, that the COVID-19 preventative activities for prevention activities are also similar. The only thing, Lassa is more fatal, while the COVID-19 is more prudent. The faster of infections, this is fatal of killing the patients more and more compared to COVID-19. The PPE and all activities are available. Both the protective gown, the boot, the goggle, and all of you were all ready, including the drug for treatment of Lassa Fever. We're ready.
All right, now let's look at access to quality health care is vital to human existence.
Yes,
looking at the primary healthcare system, how effective and efficient is this system in the state, and how has it been accessible to those in the rural community?
Thank you. I think this is quite very impressive. There are several activities that have been going on in health reforms that we have to bring to the note of the entire populace. And assessing healthcare and quality healthcare becomes the priority of this governance of Engineer Abdullahi Sule. He has made it clear, and that is one of the cardinal points in making sure we improve health security to our citizenry. Our major focus is to make Nasarawa State a health tourist environment for people to access and to take comfort from such. You might be aware, sometime back last year and early this year, even with the evidence of COVID-19, His Excellency has directed the upgrade of over 60 primary health care across the state, with no local government taking less than 5 of such facilities. It's also be pleased for you to be reminded that His Excellency flagged off the distribution of equipment sometimes around March, April this year. That is to tell you that he's willing and his intentions to strengthen the primary health care across the state and to make it worthwhile for people to access and give the best of what they can to go through. Of recent, I think last week, Friday, His Excellency, the Deputy Governor, represented His Excellency, the Executive Governor of Nasarawa State, Engineer Abdullahi Sule, to flag up the distribution of National Health Insurance Scheme ID card for vulnerable groups. All this is to ease accessibility to healthcare, and the target is primary healthcare, and which they are all attached to. For those who are vulnerable, can easily go and access. And even the health insurance scheme that was flagged up since last year, December 2019, on 12th of 12, was for every single individual to pay only 10% commitment for them to have the full attentions of healthcare services across board. And while this comes to full plate, we can assure you that the citizens and those who get registered, including the vulnerable that has flagged off on last Friday, who walk out to any of their facilities and access care. Again, to add more to this, we are aware, and he did mention His Excellency at that Friday in the arena, that the basic healthcare provision provided by the national government, Nasarawa State, is also inclusive. And this is to ease, one, to improve, pay services, and make sure people access healthcare at all levels with the quality health services to be governed. I assure you that primary healthcare in Nasarawa State are no exceptions. They are also inclusive. We will continue to add more and give the best of our effort that the more coverage of individuals are covered with a better and more accessible healthcare. It will also interest you to know that His Excellency has directed and given approval for us to liaise with National Youth Service Council, with the coordinator of Nasarawa State, NYSC, for them to also assist us with personnel, a medical doctor, nurses, pharmacists, medical lab scientists, of reputable and well-intellectual skills to flush them across some of our comprehensive primary health care. This is on course. We are in discussions to make sure we foment that. As a last time, it will also interest you to know that some of the highly skilled consultants from tertiary institutions, the latter other specialist hospitals, and that of Federal Medical Center Kefi. We're also in memorandum of understanding, His Excellency has directed. We are in talk. We hope for another soon that the high-skilled consultants will also be deployed to some of our general hospitals and with some of our primary health care that are comprehensive, so that we can attend to some of the cases before they go to situations that might become emergency. We can knock them from the ab issues. Thank you.
All right, now let's look at the 2021 appropriation bill that was submitted to the State House of Assembly some weeks back. Yeah. The health sector was given 11.4%. It was one of the major sectors that was highlighted in the budget. Yeah. With this priority given to the health sector, what should we expect?
Thank you. I think we're all in a revolutionary time, and health is also revolving. And we hope that if we can sustain what we have gone through with all the fight against COVID-19, with less than about 8 billion naira allocated to us as of last year, and we're able to do the best we can do. One thing is allocating funds to ministry. Another thing is approval and release of those funds for us to take the action accordingly. It is our prayer in here that those money allocated will live to it and get the approvals and releases for us to combat the best we can. It might interest you to know that while we are living 2020-2021, we have two new agencies that may have to also evolve over time. One of it is the Infectious Disease Center that was commissioned by His Excellency, the Vice President. That is coming to full force. We've told you clearly that is an edifice comparable to none within the nations, not even West Africa, and probably one of which might challenge as a reference in the whole Africa as a continent. We live to expect that if that place comes to functions, we expect partners, NGOs from all our sundries within and outside the country to come in and partner with us and bring succor, not just to the state, not just to nations. We might try to help both infections, known and unknown. Nasarawa State will be a reference point for us to be. Again, I'm also wish to inform you that we are expecting Drug Management Agency to also come online. And this agency is meant to cover all drugs and pharmaceutical products related to hospital use, so that it creates a PPP environment to lessen burden on the expectance of governance at all times, so that private individuals' constitutions can also come in. This will bring down the cost of medications in hospitals. It also bring down and make sure competitive rooms are also made in place with qualitative products across our board. We can beat your chest and tell clearly what accessory activities that goes within the facilities you have, and while the drugs and other facilities are made of a quality environment, you are assured that our patient will live shorter in the hospital environment, and they will get clear faster, while mortality and mobility at the long run will be reduced. It is a great target. We inform you clearly that the 2021 budget, if truly harnessed and put into use, we expect to improve and get a better result in assessing both quality and health facilities will be available to our citizens, and we will leave left unturned. The differences will be clear as we march forward.
All right, thank you very much, Honorable Commissioner. Thank you for granting us audience. We do appreciate it.
Thank you.